Good night, dear students. Today we are discussing about the question pattern for upcoming examination Drug Inspector APSC examination 2026. So let's get started. The answer copies of all these questions. When was the first pharmacy educational program started in? When was the first pharmacy educational program started in? The answer of this question is 1947. Option number B, 1947. When was the first pharmacy educational program started in India? 1947. Let's go to question number 2. Which university in India started first B pharmacy course? That is Banaras Hindu University. In which year the Pharmacy Act passed in India? Question number 3 is option number B, that is 1948. Let's go to question number 4. Which organization regulate pharmacy education in India? That is option number B, Pharmacy Council of India, PCI. Which body governs the professional standards of pharmacist in India? That is option number A, PCI, option number B, AICTE, option number C, MCI, Medical Council of India, option number D, Indian Pharmaceutical Association. The answer of this question 5 is question option A, that is PCI, Pharmacy Council of India. Which body governs the professional standards of pharmacist in India? The answer of this question is PCI. The Indian pharmaceutical industry ranks globally in terms of volume. The Indian pharmaceutical industry ranks in globally is term in volume. Which rank is governing this India among all the country in the world? That is option number C, third. Let's go to question number 7. What is the main rule of Indian Pharmaceutical Association, IPA? What is the main rule of the Indian Pharmaceutical Association? The answer is option number C, promoting the pharmacy profession. Promoting the pharmacy profession. Let's go to question number 8. Which association represents the interest of pharmacists in India? Which association represents the interests of pharmacists in India? That is option number B, IPA, Indian Pharmaceutical Association. Which association represents the interest of pharmacists in India? The option number is B, IPA, Indian Pharmaceutical Association. Let's go to question number 9. Which of the following career options is available for pharmacy? Which of the following career options is available for pharmacy? All of the above. Clinical pharmacist, industrial pharmacist, and regulatory affairs. So the right answer of this question is option number D, all of the above. Let's go to question number 10. Which is a key skill required in the field of pharmaceutical research? Which is the key skill required in the field of pharmaceutical research? Option A, communication. Option B, analytical thinking. Option C, marketing. And option D, none of the above. That is option number B, analytical thinking. Okay. So let's go to question 11. That is pharmacovigilance refers to option number B, monitoring the safety of medicine. Pharmacovigilance main जो work function that is monitoring the safety of medicines, not production of medicine. It cannot promote the pharmaceutical products, and it cannot regulate the compliance. The correct answer of this question is monitoring the safety of medicines. Let's go to question number 12. Which sector provides maximum employment for pharmacy graduates? Which sector provides maximum employment for pharmacy graduates? That is option number C, pharmaceutical industry. Which sector provides maximum employment for pharmacy graduates? That is option C, pharmaceutical industry. Let's go to question number 13. What is the role of hospital pharmacist? Manufacturing medicine is not dispensing and advising on the safety use of medicine. Yes, there is the right answer. Option number B, promoting sales of drugs, not. And option number D, researching new drugs, not. Dispensing and advertising on the safe use of medications. That is the right answer of this option is B. Let's go to question number 14. Which of the following is not a career option in pharmacy? That is option number B. 14, option number B, not a pilot. 15. What is a pharmacopoeia? What is a pharmacopoeia? 15. Answer number B, a book standard of drugs. A book standards of drugs. What is a pharmacopoeia? A book standard of drugs. A book standard of drugs. Let's go to question number 16. The Indian Pharmacopoeia IP is published by. Indian Pharmacopoeia is published by option number A, PCI, option B, CDSCO, Central Drug Standard Control Organization, and option number C, IPC, Indian Pharmaceutical Committee, and option number D, WHO. Not WHO is not the right answer, but the Indian Pharmacopoeia is published by IPC, Indian Pharmaceutical Committee. 17. USP stands for United States Pharmacopoeia. Let's go to question number 18. What is the focus of the British Pharmacopoeia? Pharmaceutical standards in UK, herbal drugs, homeopathic drugs. The right answer of this question is option number D, all of the above. Yeah, what is the focus of British Pharmacopoeia? It is not herbal, it is not for homeopathic drugs, it is only for allopathic drugs, that is pharmaceutical standards in the UK. Let's go to question number 19. The right answer for question number 18 is option C, pharmaceutical standards in the UK. 19. Let's go to question number 19. What is the function of a national formulary? National formulary. What is the function of the national formulary? That is option number B, drug standards and formulations. Drug standards and formulations. formulary है इसलिए formulations का ज़रूरत है. Then let's go to question number 20. Which pharmacopoeia is specifically focused on veterinary medicine standards? Which pharmacopoeia is specifically focused on veterinary medicine? That is option number D, none of the above. Let's go to question number 21. Extra pharmacopoeia is commonly known as Martindale. Extra pharmacopoeia is commonly known as Martindale. Let's go to question number 22. Which of the following pharmacopoeias is published annually? Which of the following pharmacopoeia is published annually? Option number A, IP, option number B, British Pharmacopoeia, and option number C, USP. The right answer of this question is USP, United States Pharmacopoeia. Let's go to question number 23. The latest edition of Indian Pharmacopoeia was published in. The latest edition of Indian Pharmacopoeia was published in 2020. The latest edition of the Indian Pharmacopoeia was published in 2020. How often is the Indian Pharmacopoeia typically used? How often is the Indian Pharmacopoeia typically used? That is option number B, every 5 years. How often is the Indian Pharmacopoeia typically updated? 24. That is option number B, every 5 years. Which organization is responsible for publishing the Indian Pharmacopoeia? Which organization is responsible for publishing the Indian Pharmacopoeia? Option number B, IPC, Indian Pharmaceutical Commission. Which organization is responsible for publishing the Indian Pharmacopoeia? Indian Pharmaceutical Commission. Question number 26. The Indian Pharmacopoeia includes standards for. 26. Option number D, all of the above. Drugs, medical devices, vaccines. The Indian Pharmacopoeia includes standards for all of the above. Option number 26 is drugs, medical devices, vaccines, all of the above. Let's go to question number 27. One of the primary goals of the Indian Pharmacopoeia is to ensure 27B, quality, purity, and strength of medicines. quality, purity, and strength of medicines. One of the preliminary goals of the Indian Pharmacopoeia is to ensure quality, purity, and strength of medicines. Let's go to question number 28. Which section of the Indian Pharmacopoeia deals with biological standards? Question number 28 is option number D, volume 4. Which section of Indian Pharmacopoeia deals with biological standards? That is option volume 4. Let's go to question number 29. Indian Pharmacopoeia is recognized as a legal document under which law? Indian Pharmacopoeia is recognized as a legal document under which law? That is option number B, Drugs and Cosmetic Act 1940. Drugs and Cosmetic Acts DC Act 1940. The Indian Pharmacopoeia recognized as a legal document under which law? That is Drugs and Cosmetic Act 1940. Let's go to question number 30. Which edition of the Indian Pharmacopoeia was the first to include veterinary drugs? Which edition of the Indian Pharmacopoeia was the first to include veterinary drugs? That is option number C, IP 2014. IP 2014. Good night.